Did you know that osteoporosis affects millions worldwide, silently weakening bones and increasing the risk of fractures? But what if there was a way to help strengthen your bones while also protecting your overall health? That's where SERMs, or Selective Estrogen Receptor Modulators, come into play, a game changer in osteoporosis management. In this video, we'll break down how SERMs work, their unique benefits, and what makes them different from other treatments. Whether you're exploring options for yourself or a loved one, stay tuned to discover how SERMs could be a key part of the solution to healthier, stronger bones. Osteoporosis is a skeletal disorder characterized by weakened bones, which increases the risk of fractures. Among the treatments available, selective estrogen receptor modulators, SERMs, have emerged as a significant option. SERMs are a class of medications that act on the estrogen receptors in the body. Unlike estrogen, which has a uniform effect on estrogen receptors throughout the body, SERMs can selectively stimulate or block estrogen receptors in different tissues. This selective ability allows SERMs to confer the bone protective effects of estrogen without some of the risks associated with estrogen therapy, such as breast cancer. Before we continue, please consider subscribing and don't forget to hit the thumbs up button. Estrogen plays a crucial role in maintaining bone density. It inhibits bone resorption, a process where bone tissue is broken down and the minerals are released into the bloodstream. With age, especially after menopause, the decline in estrogen levels can lead to an increase in bone resorption, resulting in osteoporosis. SERMs help mitigate this risk by mimicking the beneficial effects of estrogen on bone tissue. SERMs for osteoporosis management are primarily prescribed to prevent and treat osteoporosis in postmenopausal women. They work by binding to estrogen receptors in bone cells, reducing bone turnover, and preserving bone density. This action helps in lowering the risk of fractures, which is a common and serious complication of osteoporosis. The mechanism of action of SERMs is both fascinating and complex. They function as estrogen agonists in some tissues and antagonists in others. For instance, in bones, they act as agonists, thereby preventing bone loss. However, in breast tissue, they act as antagonists, which can help reduce the risk of breast cancer. Several types of SERMs are available, each with its unique properties and effects. The most commonly prescribed SERMs for osteoporosis include raloxifene. It is the most widely used SERM for osteoporosis. It has been shown to increase bone density and reduce the risk of vertebral fractures. Bazidoxifene. Often used in combination with estrogen in postmenopausal women, it provides the benefits of estrogen therapy while minimizing the risk associated with estrogen alone. Tamoxifen. Although primarily used for the treatment and prevention of breast cancer, it also has effects on bone density. While SERMs offer a targeted approach to managing osteoporosis, it is important to be aware of their side effects. These effects can vary depending on the specific type of SERM used, the dosage, and the individual patient's response. Here are some of the common side effects associated with SERM therapy. 1. Hot flashes. Similar to the symptoms experienced during menopause, hot flashes are a frequent side effect due to the estrogen-like effects of SERMs. 2. Leg cramps. Patients may experience cramps in the legs, which can often be managed with lifestyle modifications and sometimes require medical attention if severe. 3. Flu-like symptoms. A general feeling of being unwell, akin to flu symptoms, can sometimes occur when starting SERM therapy. 4. Nausea and vomiting. These symptoms can occur but are usually transient and can be managed with dietary adjustments or medication. 5. Indigestion. Some patients may experience gastrointestinal discomfort, including indigestion or abdominal pain. To manage these side effects and others, healthcare providers may recommend dose adjustments, symptomatic treatments, or switching to alternative therapies. As a patient, you should report any side effects you experience, as some may require prompt medical attention. It is also worth noting that not all patients will experience these side effects, and for many, the benefits of SERMs in reducing the risk of fractures far outweigh the potential risks. However, the decision to use SERMs should be made after a careful discussion between the patient and their healthcare provider, considering all individual risk factors and health status. Regular follow-ups and monitoring can help to mitigate these side effects and ensure the safe use of SERMs in the treatment of osteoporosis. Compared to other osteoporosis treatments like bisphosphonates or hormone replacement therapy, SERMs offer a unique advantage due to their selective action. However, the choice of treatment must be individualized, taking into account the patient's overall health, risk factors, and preferences. Understanding how SERMs compare to other treatments is crucial for making informed decisions about osteoporosis management. Bisphosphonates. Unlike SERMs, bisphosphonates do not have estrogenic effects, which means they do not carry the same risks of blood clots or strokes. However, they lack the beneficial effects on cholesterol levels that SERMs may offer. Hormone replacement therapy, HRT. SERMs provide a selective approach, aiming to reduce the risks associated with HRT. They are often considered for women who are at higher risk for breast cancer or cardiovascular disease, and for whom HRT is not recommended. Denosumab. Denosumab offers an alternative for those who cannot tolerate bisphosphonates or SERMs and is administered via a subcutaneous injection twice a year, which may be more convenient for some patients. Calcitonin. Calcitonin may be used for short-term treatment or when other medications are contraindicated. It does not have the same potential for serious side effects as SERMs, such as blood clots. Parathyroid hormone analogs, teriparatide and abaloparatide. These treatments are typically reserved for patients with severe osteoporosis who have not responded to or cannot use other osteoporosis medications. They are not associated with the estrogenic side effects of SERMs. Regular monitoring is crucial when on SERM therapy. This includes periodic bone density tests to assess the effectiveness of the treatment and regular checkups to monitor for side effects. Lifestyle modifications, such as diet and exercise, also play a vital role in managing osteoporosis alongside SERM therapy. SERMs represent a significant advancement in the treatment of osteoporosis. By selectively modulating estrogen receptors, they offer a tailored approach to preserving bone density and preventing fractures in postmenopausal women. While they are not devoid of side effects, their benefits in osteoporosis management are substantial. Thank you for watching. If you enjoyed this video and learned something new, do me a huge favor and click that like button. It really helps the channel and ensures that we can continue bringing you more content like this. And if you haven't already, hit that subscribe button and turn on notifications. You won't want to miss what we have in store for you.